Welcome to DocsOnCall, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening and welcome. This is Docs on Call, and tonight's topic is certainly timely. With kids back in school and the start of flu season, our children's health is top of mind for many Central Illinois families. As parents, when do you know your child is sick enough to visit the doctor's office, or if you should go to the emergency room? What about the H1N1 virus? These and other questions will be answered by our experts from the Methodist Medical Center team tonight. Pediatricians Jocelyn Pedrosa and Amy Christensen are part of the Mount Holly Pediatrics group, and we welcome them to our broadcast tonight. Thanks for being with us. And you bring different specialties, really. I should say Amy specializes in infectious disease and behavioral pediatrics. And Jocelyn, you see kids of all ages, and I bet your office has been very busy lately with flu symptoms, right?
That's right.
Well, folks at home are wondering the differences between cold and flu, for example. When is it just a really rotten cold, and when is it the flu? So let's start by talking about some of those differences between cold and flu.
Well, for one thing, a cold usually starts gradually. You know, you might have some upper respiratory symptoms, a cough, a runny nose, and then it builds up. You might have a low-grade fever, but usually it's not very high. Whereas in influenza, it's usually quite sudden. You'll have a significant fever along with the respiratory symptoms.
And you're mentioning the fever there as we're looking at a graphic right now. The difference there between the fevers is that there's a significant fever, particularly with H1N1, but any kind of flu. Mm-hmm. Coughing, you were talking about the respiratory symptoms?
Yeah, and the children tend to look more ill. They're very achy. They can have some very bad muscle aches, along with just feeling very lethargic with higher fevers.
Stuffy nose, more common with colds than the flu, right?
Yes,
yeah.
But you can see both, but you can have both slight congestion as well as cough with flu. But I think the main thing is that children seem a lot sicker with the flu. They act more ill, and they've got higher fevers and muscle
chills
aches.
Are certainly a symptom of the flu. And I think we've got a couple of other things to show with tiredness, sneezing, sudden symptoms. You were mentioning timing earlier, that it is more sudden with the flu, and that the tiredness is more mild with a cold patient than it is with somebody with the flu. And then I think lastly, we've got sore throat and chest discomfort. What are the differences there between cold and flu?
Well, I think a little bit of a sore throat is not unusual at the beginning of a lot of regular colds, as well as sometimes with the influenza. But you're having significant chest discomfort. I think that would be a reason to seek medical attention.
And certainly with lower respiratory symptoms, wheezing, having shortness of breath, and just not being able to breathe well. Some kids will tell me it hurts, or usually alerts us that there might be a more significant infection going on.
And when you hear a child cough, for example, you can tell if it's a more productive cough, which might sound bad, but that's kind of what you want to hear, right? That they're getting something out of it instead of one that doesn't seem to be doing them any good except hurting a lot, maybe. Mm-hmm. Mm-hmm. Yeah. Well, I know this speaks to me personally, and I'm sure it does to a lot of folks at home. Just had a child diagnosed with the flu, and you could tell right away. It came on very suddenly. And boy, it just wiped him out for several days. Now, the question that some folks might have then, we kept him home through the time period when he had the fever, and then even for a couple of days after that, just to make sure. Is that typical? Is that what we should be doing? Are people sending their kids back to school soon? What are you seeing?
It seems like people are being very judicious about sending their kids back to school. Now, the CDC recommends that you wait until you're fever-free for at least 24 hours without any anti-fever medicine on board.
Okay. And the key there is for folks to follow that. We want our kids to get back to school soon and not miss too much, but we also don't want anybody else to get sick. Let's see, we're going to be taking some calls here very soon. I know we've got Elaine from Creve Coeur, and we'll see if we've got a thumbs up yet to take her call. Not just yet. We will get to her, I hope, momentarily. And I also wanted to talk some about some news that came out today. If you guys saw the latest report from the federal government about concerns that there's been a pig that tested positive for H1N1, and we've been talking, over the last several months, just because it's been called swine flu or H1N1 doesn't mean you can't eat pork. People are going to hear this latest study and think, wait a minute, you said it was safe, maybe it isn't. What do you guys tell your patients?
Well, I think it's safe to eat pork. I really do. I don't think you'll catch the swine flu from it. So it's certainly not from the meat that you eat, but that it's a respiratory virus that's passed from the secretions from your respiratory tract.
Very good. What are you telling folks the number one way to keep our kids healthy, whether it's cold or flu? Seems like a basic question, but I'm sure you get it a lot.
Wash your hands a lot, use hand sanitizers, cough into your sleeve, and if you're sick, you stay home.
Well, and you bring up staying home. Do you think it would be a good idea just to close our local schools for a couple of days even to get people, to get everything clean and maybe to get some of those germs out of the air?
Well, I think that if the schools have a certain percentage of absenteeism from this virus, then one would have to consider it, but I think we'd have to just kind of get to that point. And I think each school district is going to have to determine when that point would be.
Okay. Well, I mentioned Elaine from Creve Coeur a moment ago calling in. She is on the line now. And Elaine, we'd like to take your call. What's your question?
Yes, I have a child who has autism, and, I've been doing a lot of research, and I'd like to know specifically with the H1N1, if the injection has thimerosal, the mercury-based preservative in it, or the nasal spray, because it's very difficult for parents with autistic children to figure out what to do here.
It's a really good question and something that I'm sure you're very, very concerned about. If you are concerned about thimerosal content in vaccines, the single dose or unit dose flu vaccine does not have thimerosal in it, but the multi-dose does. So if you consider doing any sort of flu vaccine and you're concerned about thimerosal, I would suggest going with the single unit dosings, and that should be thimerosal free.
All right. Thanks, Elaine. Great question. I believe we've got Gail on the line next. We're going to take Gail's question. Are you there with us, Gail? Okay, Gail, what's your question?
Yes, my 13-year-old and 17-year-old both tested positive for influenza A. And my question is, should they still get the vaccine for H1N1?
Good question.
Yes,
so if
that's
they've
a-
tested positive already for flu A, should they still go ahead and try to get the H1N1 vaccine?
Unless you have tested positive for the H1N1 via the PCR method, it's recommended that you still get the H1N1 vaccine. I mean, a lot of the kids who test positive for influenza A will have the H1N1, but you got to be tested with the PCR via the PCR method.
And that's a very good point here, because we've heard a lot here locally that about 95% of those who are testing positive for flu A likely have H1N1, but they're not automatically doing the test
Right.
of which you speak. It's expensive too.
And it really, in the outpatient setting, it's not very useful at this point because it takes such a long time to get the result back. It takes about a week. So by that time, your physician or medical care provider would have made a clinical judgment whether to test or not.
All
I mean, to treat or not.
Okay. We've got one more question before we take a quick break, and that question comes to us from Julie in Benson. Julie, what's your question?
Yeah, my son has a trach, and I am not getting a good response from the doctors on if they think he should get the H1N1 shot. What do you guys think?
Boy, that's a great question. I personally think that young people who have higher risks and chronic illnesses, especially lung problems, should probably get the H1N1. I have several chronic lung patients with trachs that we will be putting at the top of the list to get H1N1 vaccine. I think that probably close to 50% of the patients that are hospitalized right now with